are calling for accountability and action to restore the confidence of healthcare in South Africa. They are saying that it is becoming increasingly difficult to deliver healthcare to the nation while healthcare workers feel besieged. This after two medical practitioners were arrested and charged with culpable homicide following the death of a child who died due to severe complications during an operation. Well, now to discuss this, we are now joined via Zoom by Dr. Chris Archer, South African Private Practitioners Forum's CEO. A very good afternoon, Dr. Archer, and thank you so very much for joining us here on SABC News.
Good afternoon, Flo, and thank you for the invitation.
As a start, I mean, what are the sort of implications of these arrests to the service that doctors provide? I can imagine that there is a bit of nerves and fear around how you do your work.
Well, I think we're concerned mainly that due process was not followed, or doesn't appear to have been followed. You know, we're aware of the precepts of the Inquest Act, but in this instance, although the Act does allow for a medical practitioner to be arrested on a suspicion of having committed a criminal offence, the issues are often, and in this case certainly, are complex. If you look at medical legal issues that are contested in court, there's often strong disagreement between experts as to what the factors were that led to the matter reaching court, so it's really that concern that there appears to be a continued failure on the part of the Health Professions Council of South Africa to comply with its mandate of protecting the public and guiding the profession. The criminal justice system also seems to have failed in its responsibility with respect to the way in which this process was handled. And despite the fact that we in December wrote to all of the different authorities, including the Minister of Health, the Minister of Justice, the Minister of Police, the Director of Public Prosecutions, and the HPCSA, we've had very little in the way of response. And we wrote to them again very recently, prior to making the decision to mount this media campaign. And that decision was taken again, basically on the basis that we'd had virtually no reaction from any of the authorities to our concerns. And ultimately, I guess the concern really is that if this trend continues, then we may find a situation where doctors are reluctant to actually even go into practice or to perform complex procedures that may carry with them a complication rate that is, considered quite severe. And therefore, patients who need these sort of interventions won't be getting them. And I think that could have serious implications, not only for the medical profession, but for the whole South African population. Right. So that, I think, in a nutshell, is our concern. We would like to have a meeting with the authorities where these concerns of ours can be addressed. And this is not happening. So in the absence of that, we are now regrettably turning to the media and to the public to see whether they can bring pressure to bear, because we are concerned at the consequences of a lack of action on the part of the authorities.
All right, we're talking about the authorities, and I'm going to play devil's advocate here, because obviously this is not a PR exercise for people in the medical profession, Dr. Archer. Certainly there should be some sort of consequences where there's been, for instance, negligence on the part of medical practitioners. I don't think that that's the point that you're arguing. Certainly that should be the case, that there is some sort of consequence where someone in the medical profession has indeed acted in a way that was, that led to a death, for instance. The first part of my question is, What do you believe the consequence for that should be? Because I think there is a problem. One of the problems that you're having is that now there are arrests. There's an arrest that's now happened, and it's gone through the court process. So that's the first part of my question. What you believe the consequences of such negligence should be. The second part of my question, you mentioned that this particular case, and I'm also obviously not asking you to delve too much into it because it is currently in the courts. You say that the issues are complex. What are those issues that you can perhaps tell us as the media? You're saying you've turned to the media, so surely then you should be able to paint a kind of a picture for us so that we understand from your side. For many people who've lost loved ones to what they believe is medical malpractice or whatever, would not be kind of feeling any kind of sympathy towards you and other doctors at this point. So perhaps you can let us in on why you believe that the issue was too complex to have been handled the way that it was. Because I don't think that the authorities would arrest anyone just haphazardly for absolutely no reason. So just two parts to my question there, Dr. Archer, if you can please just answer that for me.
Well, I think really that's the nub of the issue. I mean, we all agree that nobody is above the law, and if a medical practitioner has broken the law, then he needs to face the consequences. That's absolutely given. But when I say it's complex, the issues, I mean, very few people understand what actually happened in that procedure. And I don't particularly want to dwell on this particular procedure because it's much wider than one case. But as I mentioned earlier, in a court of law where malpractice issues are often debated, there is strong disagreement amongst experts as to what actually happened. So all we are saying is that we need to make sure that due process is followed, that all the evidence is brought to bear so that a just and fair solution can be found at the end. Because we do need the general public to have faith in the medical profession. That's an absolute given. But we also need the medical profession needs to have faith in the authorities. Yeah. And at the moment, I guess there is a lack of faith that there's a strong feeling that in this particular instance, political pressure led to what can only be described as a circus involving the arrest of these two doctors, while they had to be handcuffed and then paraded through the city of Johannesburg with sirens blaring and a huge entourage of journalists, staggers the mind, quite frankly. And that is totally inappropriate. And it's that sort of reaction that we are really concerned about making sure it doesn't happen in future.
Yeah. I would assume, Dr. Archer, that you have been in conversation with the health ministry. Of course, our minister at the moment is very busy with issues relating to COVID-19, but I would assume that there has been some sort of engagement then with the Department of Health. Can you talk to us about that? And what?
Unfortunately, all I can say is that's not true. We have written to the minister. Yeah. We've written several times to the minister. But we haven't even had the courtesy of an acknowledgement of receipt of the letters. He's just ignored us. And I think that is inappropriate for a Minister of Health.
All right, Dr. Archer, you know what? We will certainly try to get hold of the minister to answer to the letter that you sent. But just in closing, as we wrap up our conversation, where to from here in terms of the support that you are giving as the SA Private Practitioners Forum, and really, I would assume that you've spoken to these doctors. What is their state at the moment? I really don't assume that there's any doctor who really wants to see people dying on their table. What are they saying? What is their feeling at the moment? As of course you are, at the other end, sort of trying to fight their fight for them. Where are they at the moment?
Well, regrettably, as you probably know, Flo, the one doctor is no longer with us. Yeah. He was murdered, and what the circumstances around his murder is we do not know, and we don't want to prejudge. And we just hope that the perpetrators of that heinous crime are actually brought to book, and the sooner the better. and the other doctor has been forced into hiding.
Yeah.
So the outcome of what has been, I can only describe as a botched process, has been regrettable on all sides. We would like to see an appropriate process instituted and we're not asking for anything that isn't already on the statutes. We just want them to be applied with the correct amount of decorum. And we are not putting the profession above the law, not in the slightest. Mm-hmm. If there are doctors who are guilty, and particularly repeatedly guilty of malpractice, then they must face the consequences. That's an absolute given. We want to reassure the general public that our intention is to ensure that they are in safe hands, and that we have the doctors and the nursing staff. And because it's not just the doctors, and we've had, unfortunately, there have been incidences that have involved nurses and paramedical people in recent times, and we need to, we don't want this to become a trend, because that will act to the detriment of all the people of South Africa.
All right, Dr. Archer, we're certainly going to stay on this story, and you've certainly given us information that certainly we were not really aware of at this time. So we will take it upon ourselves indeed to send through the message. If, of course, the Minister isn't watching, we'll certainly try to get the message through. But thank you for giving us your time, and hopefully you'll avail yourself again so that we can really get to the bottom of these issues. And, of course, you've turned to the media indeed for help, and certainly that's what we will try to do. Thank you very much, Dr. Archer, for your time.
Thank you. Thanks very much. Bye-bye.
All right. That's Dr. Chris Archer, SA Private Practitioners Forum CEO. And, of course, you can see it is quite a serious issues that they are dealing with currently at the moment. We'll certainly try to stay on that story and give you more information and updates on it. And hopefully the Minister of Health can certainly address the SA Private Practitioners Forum. So that is the CEO there speaking to us, Dr. Chris Archer.